Lupus is an autoimmune disease of unknown cause. In patients with lupus, the immune system that is supposed to protect the body against any foreign attack from bacteria, viruses, or parasites gets activated for a reason we don't fully understand, and it remains active. It cannot go back to its relaxed state, and that could result in chronic inflammation in the whole body. So lupus could virtually affect every single organ in the body. Oftentimes, it likes the skin, the joint, and the kidney. Lupus is a disease of a very wide spectrum, meaning that patients with lupus could have a very mild version of the disease that could be simply some fatigue, joint pain, and skin changes. But on the other hand, some other patient could have a very serious and severe disease that could result in terminal damage of some of their organs, specifically the kidney. Oftentimes, patients with severe lupus, they could have renal failure or kidney failure and ended up needing dialysis. So who gets lupus? Lupus is a condition that could affect pretty much every single person, men, women, all races, but more commonly, it would be seen in African American and Hispanic females in childbearing age. Lupus also runs in families, meaning if you have a family member who has lupus, you would have a higher risk of getting the disease. There's also some environmental factors that could trigger the immune system and cause lupus, such as the ultraviolet light. So sun exposure is known to trigger lupus flare in patients who already have the diagnosis. We also know that some medication could trigger lupus. So what do you do if you were diagnosed with lupus? First, you need to know how severe your disease is. Second, there are a few things that you can try to avoid that would lower your risk for having a lupus flare. Avoiding sun exposure, stop smoking, avoiding certain medication that could trigger a lupus flare, such as hydralazine, which is a blood pressure medication, and minocycline, which is an antibiotic, and both medications are notorious for causing lupus flares. If you're a woman and has lupus and planning to get pregnant, make sure your disease is under good control before you get pregnant. Lupus oftentimes causes the pregnancy to be more complicated and would put you at risk of having miscarriages and early labor. Finally, speaking with your rheumatologist about the medication that will calm down your immune system and keep your lupus under good control.